Hi guys, my name is Alyssa. I'm a PA here at ROSM. Today we're going to be talking about common causes of shoulder pain and different ways that we treat it. The most common causes of shoulder pain that I tend to see in office are mainly rotator cuff injuries and labral injuries. If you're not familiar with the anatomy of the shoulder, the rotator cuff is basically a collection of four muscles and their corresponding tendons that help move and stabilize the shoulder. The labrum is basically a ring of cartilage that goes around the shoulder socket and basically is the main stabilizer of the shoulder. Very often do we see these injuries occur acutely, but can also occur chronically over time just through degeneration. But I will say very commonly we do see these two injuries occur hand in hand. So they're treated very similarly. So the few treatment options we have for the first, depending on the severity of it, usually we send to physical therapy to help strengthen and help stabilize the shoulder a little bit better. If PT doesn't get people to where they want to go alone, then that's more so when we fall back on our regenerative types of treatments like prolotherapy or PRGF. We can also fall back on shockwave treatment as well. And those are typically the main options that we do before resorting to surgery. So when a patient comes in with shoulder pain, typically what we do is start with a physical exam. So I'll have them move through their range of motion, test their strengthening, do a few special tests to kind of see what in particular is causing them irritation. After that, we'll do a diagnostic ultrasound to look at all the structures in the shoulder and see specifically where the injury is and the severity of it. We have a large patient population that we treat, ranging from youth to elderly, which also leads the severity of the injuries can kind of span an entire spectrum. Acute injuries to something very degenerative. Typically, when we have injuries that are rotator cuff or labral type injuries, oftentimes people can develop frozen shoulder, which can be a very challenging injury to treat. We do have other procedures that we can do to help with that, including hydro expansions of the joint. If there's a very severe tear, like a partial thickness tear or a retracted tear, we have even more advanced procedures such as MFAT, where you basically take your stem cells and inject it into these areas to help bridge that tendon gap and help get the area to heal. We've seen pretty good success with that as well. So that is the completion of our 2-minute Tuesday. If you are someone who has been suffering from shoulder pain, feel free to come in, get an evaluation, and we can set up a treatment plan for you and get you on the path to recovery. If you enjoyed today's content, feel free to like and subscribe.